Management of animal bites. Animal bite can be caused by dogs, cats, and monkeys. The first thing you need to do is to wash the wound immediately. Wash the bite area with soap and running water for at least 15 minutes. This reduces the viral load. If available, flush with povidone iodine or antiseptic. Now there are various categories of bite. The first is category 1, which means touching or feeding animals and there is no bite. The second is category 2, which means minor scratches, no bleeding. And there is category 3, where there is deep bite, bleeding, licks on broken skin. Rabies vaccines, which include modified Thai Red Cross Regimen. So in modified Thai Red Cross Regimen, we need to give 0.5 ml intradermally at 2 sites on day 0, 3, 7 and 28. You can see in this calendar if day 0 is first Wednesday, day 3 is fourth Saturday, day 7 is 8th Wednesday, day 28 is 29th Wednesday. Rabies immunoglobulin. For category 3 bite, give rabies immunoglobulin as soon as possible, inflict around the wound and complete the vaccine schedule. Antibiotics and tetanus. If the wound is deep or dirty, give tetanus toxoid and start empirical antibiotics like amoxicillin clavulant to prevent bacterial infection. Stay alert, act early, save life.